Do you have any advice for other people who are facing something similar to you, but at a much earlier stage? Maybe they're just finding a symptom that they're worried about. Maybe they've just gone to see their doctor and they suspect a cancer. What would you say to them?
So the obvious thing is, don't go on the internet and look it up, because you will find 101 diagnoses of what it is. So you've just actually got to trust the process that it will come out and tell you. You're going to worry, so there's no way around that. So you've actually just got to live with that, and that's the hardest bit, from where you worry that you've got it to actually getting the diagnosis. After that, trust the professionals. You know, don't. So the doctor tells you something, actually they're telling you that because that's the case. You can go home and look it up on the internet and get another view, but actually that's not the doctor that's just seen you in a clinic. So, you know, trust the professionals to do it, and that's, you know, the doctors, the nurses, the dietitians, the language therapists, everyone, you know, they have got your interests at heart. And sometimes when things don't go right, you instinctively look to blame. You know, so I remember lying there thinking, you know, why has the flat failed? Who's done something wrong? But actually, that's not going to help you. So just as they didn't sort of say to me, actually, it's your own fault because you smoke. You know, things happen, but just go with it.
That sounds like good advice. How much should people reach out and ask for help if they're struggling with an early symptom?
If you've got a fear, it's easier to talk to someone who's actually been through that. So don't sit there and not make the effort. People sometimes think about going to groups, and I was probably there before I had this. You never feel that comfortable, and we've all seen the TV images of sort of group therapy and that. But actually, it's a real value. Just listening to people. You don't actually have to say anything, but you can sort of take away whatever you want from the group. So yeah, I'd always sort of say, you know, if there's a group or an individual you can go to, and then take up the option.